Thank you, Governor Raimondo, and thank you to Dr. Alexander Scott. I am honored to be here speaking alongside you today, but I am, however, saddened by the reason for my presence. As Dr. Raimondo shared, the numbers of COVID-19 cases in Rhode Island are sharply increasing. I want to take a few minutes to look beyond these statistics and share my actual experiences on the front line of the pandemic working here in the emergency departments in our community. I've worked in emergency medicine for over 20 years, and what I've seen here and experienced here in Rhode Island over the last 8 months is unlike anything else I've experienced in my career in this country. It is much closer, in fact, to that which I've experienced working in refugee camps and battlefields across the world. Despite the vast healthcare resources in our state, this pandemic has pressed us to the brink. Our hospitals are rapidly filling up day after day as the numbers in Rhode Island climb even beyond those which we saw in the surge this spring. This is why we need to remain vigilant and do absolutely everything in our power to protect ourselves and others and to halt the spread of the virus. My message for you today is that these are not just statistics and numbers, that this is real. This is affecting our state and our communities and our people. We in your hospitals are seeing the effects of this every day. My team and our teams in the emergency departments around the state, we are seeing the real patients with COVID-19. The ones who are lucky enough to have a mild illness, like the young retail worker and mother who I diagnosed with COVID-19 earlier this week. Her life is still turned upside down despite this being a mild illness, and she is still filled with fear. She immediately began to worry when I gave her the diagnosis about how many of her coworkers, how many of her customers, how many of her family members she may have inadvertently infected, despite her best efforts to keep safe. And she'll be out of work for weeks, struggling with this virus. We are seeing the real patients who come to the hospital struggling to breathe, their lungs filling with fluid, their eyes filled with fear. We know that there is no cure at this point. The best that we can do, we know, is just to support and try to mitigate the effects of this virus. I had this conversation with a fellow healthcare worker last month. He's my age and he'd been healthy, but he, like so many others around the globe, got COVID, and he ended up in the ICU on a ventilator. He did survive, but he is now suffering the long-term effects of post-COVID syndrome. He is debilitated by chronic pain. He struggles to breathe. He has a hard time getting out of bed most days. He's one of the lucky ones, but he may never get back to normal. And he is an example of how vulnerable we all are. Even if we're young and healthy, none among us is actually invincible. And we in the hospitals are seeing the real patients who die. I, along with most of my colleagues, have now been part of so many of these deaths. Because COVID-19 is so dangerous, when infected people are dying in the hospital, they often don't have family members at their side. This protocol is necessary. It has to be for the safety of others, but given the way that we know this virus behaves and is transmitted, but I want everyone to understand that this means that when dying patients are in the hospital, they're usually there alone. And so I and my staff sit by them. We hold their hands, we hold up our phones to their faces so that their families can be there on FaceTime as they die, so they don't have to die alone. These are real patients. These are real people. They are dying in our state. They are dying in our hospitals with a stranger holding their hand through a glove and PPE while their families try to get a last look at their loved one over a cell phone. This is real. It is real because people are affected by this. It is real because there are those who don't get to go home from the hospital. It is real because even those who do get to go home often do not return to a normal life. And it is real because even though some of us are lucky enough to have only a mild illness, the virus still disrupts our lives. It forces quarantine and isolation and leaves fear in its wake. The human cost of this is real, and this pandemic is real. As each of these patients has a real effect on the staff at the hospitals, there are periods in the time when we in the healthcare system are overwhelmed. We try to deny it, we try to hide it, we try to work past it. But at the end of every shift, you can see it in the weariness and fear as we take off our PPE, our faces bruised and scraped by the tight-fitting masks that we've learned to be grateful for. And then we head home to our families, hoping against hope that this isn't the day we bring COVID home to our children, to our spouses, and to our loved ones. Despite all of the precautions we take, we're still afraid to hug our family members. Many of us are still sleeping in basements, on couches and tents, because we would rather do that than risk bringing this deadly virus home to our family members. Unfortunately, given the rate of spread through our communities in Rhode Island and across the country, many hospital staff members have gotten COVID-19 at some point in this pandemic. Some of our staff at each of our hospitals have died from it, both here, across the state, and across the nation. We get overwhelmed, and we feel such sadness for our patients and for their families, and in the helplessness we feel as we see this virus attack the most vulnerable among us, the medically fragile, the economically disadvantaged, and the communities of color at disproportionate rates. These are not just statistics. If I weren't so worried about getting you sick, I would invite every one of you to come spend a day in my emergency department and to live it alongside us. But I can't let you because the risk is too great. And yet it's a risk that we're taking every day because this is what we love and this is what we do, but it's taking a toll on us too. At the beginning of the pandemic, we were concerned about the collective ability of our hospitals to meet the vast medical logistical needs of the pandemic, and so we were asked to set up these alternate care sites, the field hospitals. With a Herculean effort, Care New England and Lifespan, the Department of Health, the Rhode Island National Guard, and an array of public and private groups set up these sites. The Cranston site, with its 350 beds, is ready to mobilize and open the field hospital should we need it. Thus far, we have been lucky enough in this state to be able to take care of all patients at our regular hospitals. The medical community has come together across the state and worked collaboratively across hospitals and system with tremendous support from Governor Raimondo and Dr. Alexander Scott and the Department of Health, who have all been constantly accessible to us and fully responsive to our concerns and our needs and enabled us to continue providing care at every hospital throughout the pandemic. But if we in Rhode Island continue on our current trajectory, we will outstrip our hospital's capacity, and we will need to open the field hospital within days to weeks. Let me repeat that. If we, the people of Rhode Island, don't quickly change our behavior, we will rapidly overwhelm our hospitals, and we will need to open the field hospital within days to weeks. It will be a tremendous effort to operate this field hospital, but the state is prepared and Care New England is prepared to do this if our state needs us to. Our team, who's been battling this pandemic on the front lines for months, is prepared to do this. But all of us collectively in our state have the power to prevent this. All of us have the ability to stop this virus. It requires short-term sacrifice on our part, to be sure, but we can prevent the suffering and death going forward. And we need to, because this is real. These are real patients, real people, real families, real healthcare workers, real lives. I implore all of you to reevaluate your day-to-day actions and be vigilant in your safety measures in order to help turn the trajectory away from putting our loved ones and ourselves in the field hospital. The Cranston Field Hospital is not the answer. My team works to support and mitigate, but there is no cure at this point. The need here is for prevention. Remarkably enough, the most effective thing we found to contain the spread of this disease and stop the pandemic is in the little things that every single one of us can do every day. The miraculous power of modern medicine has not yet caught up to this virus, but we do know that the seemingly simple things, wearing masks, social distancing, staying quarantined when you're sick, staying home, avoiding social gatherings and crowds, these make all the difference. The steps that Governor Raimondo and state leaders have taken to lower the social gathering limit, to restrict late night activities, to encourage mask wearing and hand washing, these are things that we all need to be doing at this point. Throughout the crisis, they have done an incredible job of looking at the data and making necessary changes to protocols for the sake of community safety, but government can only do so much. These interventions only work if each and every one of us takes them to heart and changes our practice in day-to-day living. I know that we're all tired of staying in. I know that we're all tired of not being able to hug one another. We're tired of not being able to eat together. We're tired of wearing masks. Pandemic fatigue is real, but so is everything else that I've shared with you today. Whether we give into the fatigue or we stay strong in our commitment to protect ourselves and one another, that is what will determine whether you and your families meet me in the emergency department or whether you meet me when this is all over at our kids' soccer games or the PTA meeting. I hope it's the latter, but it's up to every single one of you. We each have the power and the responsibility to stop this pandemic. Thank you for allowing me to share some of my experiences with you today. Please stay safe.